afternoon, good evening, or good morning. It depends where you're watching, but you're all one thing in common. Very welcome to the show today. I'm delighted to have my guest on, all the way from UK yet again. He's Editor-in-Chief. Oh, that's a great title. I love that title, Editor-in-Chief. No, it's not Sitting Bull. It's not one of those. He's Editor-in-Chief of Lancet magazine, and no better a time to have Lancet magazine's Editor-in-Chief on than now. His name is Richard Horton, Dr. Richard Horton. Richard, you're very welcome.
It's great to be with you, Maurice. Thanks for inviting me.
It's lovely. How's the weather back in Blighty today?
It's windy and showering and getting colder. Same in Spain?
I'm delighted to hear that. No, it's a little bit of snow, but we're fine today. My goodness, it's hot. And I'm also delighted to introduce or bring on a good friend of mine who's certainly the subject we're going to talk about is an expert on. He is Charlie Ward. Charlie, how are you today?
I'm very well, thank you, Maurice.
You're looking well and fit.
Good to meet you, Richard.
Good to meet you, Charlie.
and of course, Richard. Now, let's start all this off. Richard, we all are going, one of the reasons that I've invited you on this show is that we are living in a world of confusion. And I say confusion because none of us really know what's going on. And when we watch the British news, and which most of us watch as English TV down here, we watch the BBC News, the ITV, etc., we seem to be getting a lot of mixed messages coming out of UK compared to the way that we've sort of handled this on the Costa del Sol, certainly here in Marbella. I remember once someone rang me up from UK saying to me, "You're living in a police state." And I said, well, we're not really living in a police state. It's just that we are being protected and looked after and it's paid handsome dividends. Very confusing messages, Richard, coming out of your Prime Minister and government.
Well, I think the difficulty that our government faces is that we were just completely swamped by this tsunami of virus that swept across the world, which we actually knew about in January. And then during the month of February and early March, we just didn't take it seriously. And since the middle of March, since March the 23rd, when we locked down properly, we've been trying desperately to play catch up. And this is the great tragedy of our response. And we're still playing catch up. And I think because we've had such a confused response, you say confusion, I think that's right, but actually it may even be too generous. It feels like chaos actually here in Britain today. I mean, tomorrow, we're going to be opening up the pubs at 6 a.m. in the morning. Now, the pubs are going to open 6 a.m. in the morning. You can go in, you can buy a drink, you can sit down at a table, order some food, and it's a weekend, and the sun may be out. We could have the biggest second wave of any Western European country if it all goes pear-shaped tomorrow. So why are we bringing this risk upon ourselves? It's chaos.
You can do all that tomorrow, but you can't get married. That's what I find really extraordinary. You can play bingo tomorrow, but you can't get married. One other question, we're going to go over to Charlie in a second. I'm going to read this if you don't mind. You say NH, and I quote from you, NH bosses could have had prevented chaos and panic. You blamed at one stage, am I right in saying, I think, the NHS bosses, not the government so much at the time?
Well, I think my argument is that there's been a strange collusion between some of the scientific leaders and leaders of the NHS and the government. We've seen them at press conferences. You have a politician standing there flanked by medical advisors, and the doctors and the scientists advising government should be independent of government. They shouldn't be there to parrot and repeat the same political messages coming from ministers. It's become a cliche now, but it's certainly true that scientists advise, ministers decide. But the way it's appeared is that there has been this collusion between the two because they both sides know that they left it too late to lock down. And now we've had, the estimates vary, but it's well over 40,000 deaths at a minimum. It could be as high as 60 or 70,000 deaths. And many, if not most of those deaths were entirely preventable, which is why it's a humanitarian tragedy.
Charlie, I know that you have your take on all of this, and that's one of the reasons I read Charlie's writings a lot, and one of the reasons we've invited you on to the show today. Charlie, because I have some questions to put to Dr. Horton.
Yeah, I'm very, very grateful for this opportunity, because at the moment, it's a pleasure to be able to discuss what's going on, because what happened to me at the end of last year, 6 years ago and 2 years ago, and at the end of last year, I was told that this was going to happen from an inside source of government, the American government. They told me they were going to shut down the world's economy. I didn't believe it was possible, but it proved incredibly easy. Now, I've listened to what you said. I've done the best part of 1,000 hours of research, and you've probably done 10 times more than me to get your position at the top of the Lancet, which is highly respected, and that's why it's an absolute honour and pleasure to talk to you, because I'm talking to somebody who knows what they're talking about. And I was told that the British government and the authorities had to create confusion and fear over this virus. And from my studies, if I go to the government website, it tells me it was downgraded to nothing but the flu back in March. 4 days later, we went into lockdown. I find the same information that's hidden away on the CDC website and also on the WHO website. But the facts were that it was downgraded. The facts also, in the first 4 months of this year in the United Kingdom, the amount of people that actually died from whether it be COVID-19 or from influenza or from respiratory issues is less than the last 4 to 5 years in a row. It hasn't gone up one little bit, but the media will have you believe it has. And the government will have you believe, because I believe, and I might be wrong, you can tell me I'm wrong. I believe it's been used as a smokescreen to break down the world's economy. That's what I believe. Now, I'm not telling you I'm right. I'm telling you I was told they were going to collapse the world's economy, and they've done it. They've done it with relative ease with a common cold, which is nowhere near as bad as man flu. COVID-19 is nothing like man flu. Man flu is a lot worse.
I couldn't agree with you more. Absolutely.
That's my view.
Okay, Richard,
I love your view, Richard, on what I've heard and what I've established. I'd love to know your take on it.
Okay, Charlie. Well, let me agree with you on this particular point about influenza. It is true that the government and the scientists were planning for an influenza pandemic. Back in 2016, there was a practice run by Public Health England for an influenza pandemic. It was called exercise sickness. And we found then that we were not prepared for an influenza pandemic. Now, influenza it's not a nice disease, and the mortality varies every year, but it's got, on average, a 0.1% mortality.
Correct.
What came out of China is a virus which is not influenza. It's something very, very different to influenza. It's got a mortality at least 10 times more than influenza. Now, our planners in the United Kingdom, and actually in all other European countries as well, sadly, were planning for an influenza pandemic. And that meant that they thought that we could, as Boris Johnson, our Prime Minister, said, take it on the chin. Yeah. We could, you know, you've probably had flu in your life. I've certainly had flu in my life. It's not very nice, but you get over it.
Yeah.
And you might be a week off work, in bed for a few days. You feel absolutely terrible, but you get through it. Yeah. That is not what this is at all.
No, I understand.
And it wasn't until the intensive care units started filling up in Italy, in Lombardy and Veneto, that they realized that they were dealing with something which wasn't flu.
That's correct.
But by then, in Britain, it was too late, because by then, we'd flooded the country with virus, and it was taking off exponentially. So by the time Boris Johnson locked the country down, that was shutting the gate after the horse had bolted. Now, I don't know about the other theory that you're telling me, I can't comment on that one. I haven't heard that one before. I've heard some theories about what went on in Wuhan, but I haven't heard that one. But I do know that the big mistake we made was that we thought it was flu when it wasn't.
Can I come in there? Charlie, can I just come in there and ask the doctor this? And I'm delighted. It's Dr. Richard Horton, who's editor-in-chief of Lancet, is our special guest today. And of course, you recognise Charlie Ward. Why did the British government choose to listen to their or be directed by their scientists, but ignore what the World Health Organization were giving them?
Well, that's one of my major criticisms, because the World Health Organization on January the 30th did the most extraordinary thing. It rang a global alarm bell. It fired a rocket, a flare into the sky that every country should have paid attention to when it called what the technical phrase is a public health emergency of international concern. And when WHO calls a public health emergency, seriously, 195 countries in the world are supposed to wake up and get with the program of preparing for a pandemic. And this is the great mystery to me that's going to have to come out in a public inquiry, because for reasons that remain totally inexplicable, the government ignored it. In fact, on January the 31st, Boris Johnson gave a speech. You remember the subject we've been talking about for 4 years, the B subject. He gave a speech about Brexit in which he spoke about the great future that the country had before it, that this was going to be a golden era in the post-European Union world for the country. He didn't mention at all and didn't think about for the next 4 or 5 weeks the fact that there was this public health emergency coming. And that's why I think this is the most stunning post-war example of government misconduct. I mean, this is reckless misconduct in office by our political leaders.
You've called for an international inquiry, you personally, haven't you?
I have called for both an international inquiry and for a national inquiry. An international inquiry because the World Health Organization also made mistakes, and we do need to know what went on in China. The very first patient that we 100% know for sure was admitted to hospital. It may have been before, but the one we absolutely know was admitted to hospital was on December the 1st in Wuhan. But it took until December the 31st for the Chinese authorities to tell the World Health Organization that there was an outbreak of a mysterious new virus. Why did it take 1 month for the Chinese authorities to tell the world? That was too long a time. So we need to know what happened in China. And then WHO did call an international red alert on January the 30th, but then it did nothing. And what it should have done is convene countries together in early February to talk about what they needed to do. Instead, you had 195 countries pursuing 195 different strategies to try and protect themselves from the pandemic that was coming. And that's led to chaos.
I've got a couple of questions there that stick out with me. Number one, it was very, very clear from the start. First of all, most people in the world don't understand a virus. Well, our body is full of viruses, over 1 trillion viruses. Second of all, the coronavirus COVID-19 is not airbound. It cannot be transmitted through the air. It has to be physical. So there's things that don't tie up there. Thirdly, if we take Italy, which you mentioned, the WHO made it very, very clear that if you put COVID-19 on the death certificate, you did not need to do an autopsy or a post-mortem. So Italy waited a while and actually did 15 that I know of, post-mortems and autopsies. And of the 15 that were registered COVID-19 deaths, not one of them had died from a virus, but had died from a thrombosis. Now, maybe you
Right.
can explain to our viewers
Yes.
what the difference is between a virus and a thrombosis.
Yeah, yeah. No, this is a really, really good point, and it's very important because this virus triggers. So let me start from the beginning. In young people, you'll get the infection and you might not even know you've had it. You might be completely asymptomatic, and you just move on with your life. Coronaviruses, other types of coronaviruses, are very common causes of the common cold. So there is another group of people who will get the viral infection. They'll get a fever, they'll get a cough, a little bit like a common cold, and then they'll recover. But then there's another group, and the percentage could be as high as 20% of people, and certainly in older age groups, they're particularly at risk, who, if they get the disease, if they get the viral infection, it triggers the body to literally have an explosion inside of it. And this explosion is that it pours out chemicals into the bloodstream.
Is that
And
a thrombosis?
And these chemicals then trigger a thrombosis, exactly. So what you were seeing, the patients who were dying on intensive care, they weren't dying of the pneumonia.
Correct.
They were dying of heart attacks because of thrombosis. They
Yeah.
were dying because of problems, complications in their kidneys.
And they were put on ventilators, which doesn't help.
They were put on ventilators because they did have a pneumonia, but they weren't dying from the pneumonia.
Correct.
They were dying from something else.
Correct.
So, and this was a disease that we didn't, in the early phases of the disease, we were completely confused. We didn't know what was going on. You had a virus which caused a pneumonia, but people were dying of something completely differently. So it took some weeks, a couple of months, before we really understood what we would call the pathology of the disease. We understood the nuts and bolts of what was going on. And this is why it's so dangerous, actually, because
It wasn't helped by the funding either, because I know with the American hospitals, they got more money if people were diagnosed with COVID-19 than normal influenza, and even more money if they were put on a ventilator. That happened in Europe as well. And when it's driven by money, then people diagnose things that are incorrect, and that's not right.
Well, there is a problem about diagnosis, and that's one of the. I think that's why it's very hard to actually compare countries, because different countries have different ways of diagnosing. I mean, if I give you the other terrible example that I know has affected Spain just as it's affected Britain, is that we've actually had two epidemics. We've had an epidemic in the community, and we've had an epidemic in nursing homes, in care homes. And as many as half of people who've died in Britain have actually died in care homes. Yeah. And we had this mantra where we were talking about save the NHS. But what we forgot was we weren't saving people living in care homes.
No.
And so, unfortunately, we discharged all these people out of hospitals, and you did the same in Spain, I'm afraid. And all these people went out of hospitals, went back into the care homes, and you had transmission in those care homes. And that's another aspect of the tragedy of this.
Richard, can I come to you? Sorry, Charlie, can I come to you here and ask you about, because we have only a limited time here, about the way you see it now? We're watching or hearing in England party time today. We're hearing that Leicester has been going into a second lockdown, or has gone into a second lockdown. How do you see it unfolding now?
Yeah, well, Maurice, we're in an impossible situation because you can't live your life in lockdown. I mean, we're all going to end up in abject poverty if we leave our economy shut down like this for much longer. So we do have to open things up. But it's only safe to open things up, to send our children back to school, to return to work. It's only safe to do that if you put the necessary protections in place. And the necessary protections mean that we all have to wear a mask. I usually carry mine with me. I'm looking for it. I haven't got it with me now. We all have to carry a mask. We should avoid mass gatherings of people. We should try and keep distance from each other if you're in the supermarket. And also, the other thing you need is a fantastic test and trace and isolate system. In other words, if you get an infection, if you feel ill, then you can trace your contacts in the previous few days, track them down and make sure that they're isolated. Now, in Britain at the moment, we've got people, after Dominic Cummings, we've got people who aren't wearing masks, who aren't physical distancing, who are gathering. I live in North London and near Alexandra Park, and if I walk my dogs on Alexandra Park, there are all kinds of parties going on, and nobody's paying a blind bit of attention to the rules. And that's why I'm worried when the pubs open tomorrow. You've got all of that, and we haven't got a good test, trace, and isolate system at the moment. So we are releasing our lockdown at a really dangerous time. This is a gamble. We're playing Russian roulette right now, and we don't know where the ball is going to fall in the roulette wheel.
Charlie, they're coming here.
Well, I'll be honest with you, I totally disagree, but that's why I wanted to have this discussion.
Yeah.
With respect, you know what you're talking about, definitely, but a mask?
Yeah.
Just answer me one thing. If there was a virus within 1 meter of that mask, would it prevent it getting into your body?
It reduces the risk, Charlie. It doesn't stop it. It doesn't stop it 100%. It's a fair point you're making, but it does.
Masks are absolutely worthless. If you can spray a perfume in front of it and smell the perfume, the virus is 100 times smaller than the particles of a perfume.
Yes, but you said it yourself. It's not transmitted by air, through the air.
Correct.
So the virus is transmitted either by touch. If I have it on my finger and I touch the desk, it could be on that. Or it can be transmitted in an aerosol. So if I sneeze or if I cough. So the point of wearing the mask is that if I sneezed or coughed, it's not going to go out in an aerosol and infect somebody.
But also,
the virus can't travel through the air.
But also wearing a mask recycles CO2, which actually breaks down your immune system. It doesn't strengthen your immune system at all. And we need our immune system. Like, I'll be straight with you. I've never had a vaccine. The last time I had a cold was 20 years ago.
Mm-hmm.
The other thing that's very important, that 100% of the people who died of COVID-19, let's say that's what it is, all had a vaccine. Not one person died of COVID-19 that has not had the flu vaccine. And that's documented on the government website, the CDC, and the WHO. So the vaccine obviously does not work, because everybody that's died of it has had the vaccine, and nobody who hasn't had a vaccine has died of COVID-19.
Well, Charlie, there isn't a vaccine for COVID for SARS-CoV-2 at the moment. So
that's correct. It's a flu vaccine.
We will get a vaccine at some point. I'm sure that we will. It won't be by the end of this year, but it will be in 2021 at some point. It's very important in the Northern Hemisphere as we go into the influenza season later this year. And I really stress this, and I'm speaking now as a medical doctor, that people who are of an older generation definitely get the influenza vaccine. It's absolutely key that they get the vaccine.
Look,
for influenza.
If you've got a low immune system, I get it. But if you keep your body in an alkaline state, a virus can't exist. It can't grow. It can't continue.
But
so there's certain things to do with diet. And if we get our diet right and exercise right, we build up our immune system so we don't need it. Now, I'm not saying everybody can build up their immune system. Old people's immune system is weakened. I understand that. And sometimes they need a bit of assistance. It's a bit like helping an old lady across the road, just to get her across the road. Some people need it, but not everybody. We can build up our own immune systems to fight things for ourselves.
Well, Charlie, you're absolutely right that the fitter you are, the healthier your body, the better your diet, the more exercise you do so that you are fit and well, the stronger you will be to fight off any infection. 100% agree with you about that. But people who are older are more susceptible to more severe infection, whether it's influenza or COVID-19.
I agree.
And the great concern about coming into the autumn of this year is that you could have two pandemics. You could have you could have a wave of influenza and a second wave of this disease, COVID-19. And if the two came together, that would not be a good thing to happen. So that's why I recommend that people have the influenza shot, and why I absolutely recommend, and I understand what you're saying about the mask, but with the greatest respect,
yep,
it's not true. The mask is protective, not 100%, but it will help reduce the risk of viral transmission, as will avoiding large gatherings close together. So I really, and that's the worry here, that people won't follow those guidelines starting at 6 a.m. tomorrow.
Richard, can I just interrupt there a little bit about the mask, so that you know, to another, as we wind up. I have, of course, in my hand, two of them. I come prepared. I didn't know whether to wear them when we were on air. I wasn't sure. But my take on the mask is this: if I'm wearing a mask and other people are wearing a mask, that reminds me of what's going on. It reminds me to be careful, to wash my hands, to be careful. Mightn't protect me of anything, but we are aware. I was at the shops the other day and everybody had their masks on. They were keeping distance, not like we see in UK, I must say, but at least reminds me to be careful. And that's the purpose I see in the mask.
Absolutely. I think that's absolutely right. You know, until we do have a vaccine, Maurice, we are going to have to change the way we live our lives, sadly. Because we are going to have to live in peaceful coexistence with this virus. And, you know, it's about each one of us managing our risk. Because we can't live in lockdown forever, we're going to have to trade off risks. So absolute safety will come from a lockdown and being stuck in our homes 24/7 for months on end. We can't do that. So as we start to step outside, risks will go up, so you and I are going to have to manage them. And we do that by hand washing, by better respiratory hygiene, by making sure that we wear a mask if we're in closed spaces. I don't think you need to wear a mask everywhere. I don't think, if I'm taking the dogs for a walk in Alexandra Palace and it's a big open space, I don't need to wear a mask. But the moment I go into Sainsbury's and do the shopping, I need to wear a mask. So it's when you're in enclosed spaces. I'm sorry?
Do you really believe that?
I really do, because we've published evidence on this, Charlie. And I think wearing the mask I will fully concede it's not 100% effective, but it reduces the risk when you add it in with physical distancing, hand washing, and so on and so forth.
I think the only real place it's good to wear a mask is in a bank if you're short of money.
Listen, guys, we're going to have to wind up. You can agree to disagree. It's been a real pleasure to have you on, Dr. Richard.
Thank you very much, Richard.
And I hope you'll join us.
Thank you very much indeed.
Yeah, I hope you'll join us again with better news. And the news I think we all want to hear, and I think Charlie will agree with this, is that, well, I don't know if you do, but the vaccine.
Yes, that's 100%. Yes, that's what I want.